Dr. Hui, what are the physical effects of tear gas as soon as you come into contact with it?
Well, on exposure to tear gas, it stimulates the pain receptors in the eyes, nose, throat, respiratory tract, and also the skin, leading to burning pain in those organs, runny eyes, runny nose, and severe burn in the areas.
So what should someone do once they become exposed to tear gas?
Well, if you are unprotected, you need to leave the area as soon as possible and go elsewhere to breathe fresh air. And in case you have symptoms already, you need to flush your eyes with water or normal saline for 10 to 20 minutes. And you need to clean your face and skin with soap and water to dissolve the tear gas residue.
Now, how do you sort of treat excessive or reoccurring inhalation of tear gas? Because whether you're inside or outside, in Hong Kong, tear gas is almost unavoidable.
Well, tear gas is supposed to be used as an outdoor riot control agent. So you need to take good precaution, obviously. But if you are exposed to tear gas, you need to protect the organs. So flush your eyes with normal saline or water for long enough, and clean your skin with soap and water. And also you need to decontaminate your clothes and don't pull it up. If you pull upwards, the tear gas compound will actually affect the eyes, nose, and throat. Yeah. So you need to take precaution. Now, if it so happens that there's tear gas coming through to indoor, you did not close your windows, then you need to go upstairs, maybe 1 or 2 floors, to breathe some fresh air. Tear gas is actually combined with a solvent, so the density is higher than air. So eventually it will fall to the ground within half to 1 hour. So after breathing fresh air upstairs for half to 1 hour, you go back home and do the cleaning. And the floor, the wall will be full of the tear gas residue.
And it stays activated for a couple of days, I read.
Well, it can stay even up to 5 days. So you really need to clean the floor and also the wall with the detergent and water. If it so happens that you have curtain and sofa made of cloth, then you are in trouble. It's very hard to clean those items, and you may have to dispose them.
And then every household in Hong Kong has air conditioner inside. That's dangerous within itself if it gets into the household, right?
Yeah, you need to switch off the aircon immediately, and then half an hour to 1 hour when you return home to do the cleaning. You also need to clean the surface of the aircon with detergent and water, and you need to change the filter also.
And then what about clothes hanging outside of Hong Kong flats?
Clearly, the clothes will be contaminated. You need to wash the clothes in the long run with detergent and do a long wash.
Dr. Hui, I want to ask you, does tear gas affect elderly people differently to younger people?
Now, in the elderly who may have poor lung function, maybe existing asthma or chronic bronchitis, tear gas can actually aggravate the airflow obstruction. Young children actually are affected even more because, as I said before, the tear gas is heavier than air, so it will drop to the ground. About 3 to 4 feet above the ground, you have higher concentration. So the young children who are quite short, they actually are at maximum exposure to high concentration. And also the children have a faster respiratory rate than adults. So if they so happen to be around the site, they are actually at higher risk of exposure to high concentration. So they really should stay away from the site.
Can you talk about any frontline reporters or any protesters that have come to you to seek for your assistance?
Well, I have seen a number of frontline media reporters and also cameramen. Quite a number of them actually have persistent cough for several weeks after repeated exposure. And the cough is mostly due to aggravation of existing hay fever or rhinitis. So they keep getting itchy throat and cough. Some of them also have bronchitis, acute bronchitis induced by the tear gas. So I have to treat them with appropriate nasal medication and also inhaled corticosteroid and bronchodilator to relieve their symptoms. Now, usually the symptoms will go away if you stop further exposure after about 2 to 3 weeks.
Now, these protests has been going on for months now. What are some of the long-term effects?
Well, in general, the tear gas effects are transient, but long-term effects can occur in a small number of people. For example, if you don't flush your eyes properly, then there is increased risk of developing cataract and even glaucoma in the future. And there is also case reports of someone having been exposed to tear gas and then develop asthma-like symptoms for about 2 to 3 years. And some protesters may also develop allergic dermatitis in the skin.
What about expired tear gas?
In Egypt and also in Venezuela, they had used expired tear gas before. But at the moment, there is no conclusive data that it may lead to more harmful products. In fact, it is actually the temperature that the tear gas is ignited that matters. The US Army actually have done some experiments. When they explode the tear gas at the normal temperature of 150 degrees Celsius, they generate normal products. But when they increase the temperature to 275 to 300 degrees Celsius, then there are extra 13 byproducts. And one of the products actually can release cyanide.
Okay, Dr. Hui, use of tear gas has been called a public issue. What precautions should the public and government take?
Well, for the general public, you really should stay away from the area. But if you happen to be frontline media workers, you need to take very good precaution. So you need to have the N100 equivalent mask with filters made of activated charcoal to absorb the compounds. You need to decontaminate your skin and also clothes carefully after exposure. For the law enforcing agents, they really should use tear gas with caution. So if used properly, tear gas is a very effective outdoor non-lethal weapon to disperse crowds. And you need to use it at the edges of a crowd below knee level to avoid hitting any body parts. And you must not hit any body parts because there may be burn and even projectile injuries. And in fact, the fatal outcome has occurred in Syria and also Nepal in the past.
And then I think we've seen the use of tear gas indoors. What are your thoughts on that?
Well, I think it's totally unacceptable to use tear gas indoor, especially like in the MTR station where there is enclosed environment and poor ventilation. The concentration of the tear gas can be very high and it can actually kill someone with existing asthma or chronic bronchitis.
Okay, well, Dr. Hui, thank you so much for keeping us informed and, through these unprecedented times in Hong Kong.
Thank you.